person, and but he had Alzheimer's and died of Alzheimer's. And I have, like most of us who have hereditary issues, been terrified that that's what's going to happen to me, because my dad started having symptoms in his mid-70s, and I'm 72. So Dr. Teels, my doctor, he knew about that, and one day a friend gave me a book, Dr. Bredeson's book. It's actually the precursor to this one, The End of Alzheimer's Program, and he told me that his wife had worked with this doctor, and that she was pretty far along in Alzheimer's when she started, but that he felt that this program was really worth checking into. So I gave it to you, I think, on a Thursday, and on Monday, you called me and said, wow, and I'll let you kind of take it from there.
Thank you, Patty. Is it easier to hear if I use the microphone or without the mic? With the mic. Okay, thank you. So I'm going to talk about a subject that has been pretty much taboo most of my medical career. Doctors didn't want to talk about it, patients didn't want to talk about it because there wasn't anything you could do about it. And it was kind of a curse. And most of the surveys that have been done by anybody from AARP to any other organizations say that people are more afraid of Alzheimer's disease than they are of cancer or heart disease. So as I've worked in geriatrics for a long time, it's been very apparent that it represents not only the loss of a person's most important asset, their mind, but also often leads to their loss of independence, which is their second most important thing that they worry about. So heretofore, as Patty had mentioned, we just had a few drugs to deliver that really didn't work very well and cost a lot of money and had a fair number of side effects. Not a real good combination. So Patty introduced me to this particular person through a book called The End of Alzheimer's a couple of years ago. And like she said, I was very impressed with the hope that he presented. But like a good skeptical physician, I kind of said, show me some results. So I did some research that same weekend to try to see, other than just encouragement, whether there was any proof behind it. And this particular doctor is a neurologist on the West Coast, and he said that he was tired as a neurologist of being a doctor of failure, that nearly all the diagnoses he made were things that he couldn't do anything about. And so he quit practicing medicine and went into research and spent the next 25 years researching the brain. And he said he would come back to clinical practice when he had something to offer the patients that he hadn't had anything to offer before. So then what he did after this 25 years of research, they felt that they had some results and a program to offer. They went to the Institutional Review Board of a major Bay Area organization, hospital system, and they were turned down because the program was too complicated and it wasn't a pill. It had a lot of ingredients to it. And he was pretty discouraged. And then a couple people started calling him and saying, heard about the work you're doing. I'd like to be one of your guinea pigs. I'd like to volunteer. And so over the next couple of years, 10 people pursued his program, and 9 out of them improved, 9 out of 10. And he published that in 2014. He still then went to the Alzheimer's Association and other folks, and nobody would fund him because it wasn't a pill. So about 4 years later, he published something in a wonderful journal called the Journal of Alzheimer's and Parkinson's of the results of the first 100 people that had all improved on the program that he had. And many of them had early Alzheimer's disease. Some of them had advanced Alzheimer's disease. So when I saw that in a reputable journal, I said, now you got my attention. So I went to Patty and I said, what do you think about us trying to do this with a pilot program here in Boothbay, where we can see if we could replicate what this gentleman had done on the West Coast? And so sure enough, Patty and the health center and I recruited about 20 people to be our pilot group. We're now a year and a half, a little more than that, into that pilot group's efforts with me. And our goal was to try to replicate that kind of result. I was really green. I'm not a researcher. I'm not even a board certified geriatrician. I'm a family doctor with a special certificate in geriatrics. I'm not a neurologist, but basically that really didn't matter. Over the next 8 months, I figured out how to implement this program locally, and I had a very supportive group of 20 people in my pilot group who put up with me as I tried to figure out what we were going to do. So I'm here to tell you about this gentleman's approach and also to cheer on our results here. Because many of the individuals in this pilot group, like Patty mentioned, have a genetic predisposition to Alzheimer's disease. About 2/3 of the group of 20 had a predisposition genetically to Alzheimer's disease. Some of them had inherited a copy of that gene for this from both of their parents. And so they had a double whammy to deal with, and they were suffering already in their 60s with significant decline. So I'm happy to report that within about 6 months of being on this program, that nearly everybody in the group had stopped losing ground. They hadn't yet made any progress, but they had stopped losing ground, which had been their course over the last several years before that. And then about 6 months later, they were making small gains. The most impressive one is a retired college-level chemistry professor who was at the point where all he could do was add and subtract single digits on his fingers. And after being on the bridge with his wife every night, and he was able to do all of the scoring in his head without using his fingers. He also was able to do the highest level Sudoku every single day. And now he's playing cribbage with a whole bunch of other people and whipping them most of the time. These are small victories, but pretty important in the life of a family. Another person had struggled to find the right word. She was now able to come up with the word that she used to search for. A third person had lost some of the ability to speak in another language that she had worked really hard to master, and that language came back to her. A fourth person was struggling to even dress himself and then started dressing himself independently again. Those are little victories, and they've only been in this program for a short period of time, And then just last week, this Dr. Bredesen published a book called The First Survivors of Alzheimer's. And it was titled that because even most cancers have survivors, but nobody had ever beaten Alzheimer's disease before. So what's this magic thing, and why are we talking about it? Because there is hope, and I hope I can convey some of that to you in the next few minutes. The reason to talk about this is because Alzheimer's is really common. The biggest risk factor is getting older, and a lot of us are getting older. And it's actually more common in women than in men. And what isn't on this slide is that about 60% of the people who have it are undiagnosed. The other important things are that when you get to be 85, and in Lincoln County, that's about 10% of our population, you know? And the reality is that it's costly, and the cost is usually for the family to bear. So the sticker shock is that that's about $90,000 per person per year. And so even though heart disease and cancer get a lot more money and a lot more attention, the amount of money spent on Alzheimer's disease is greater than that. Sure, please. This slide is really too small, so don't even try to read it, but I will try to tell you what it says. And mostly it is that Dr. Bredesen's revolutionary approach is different than Big Pharma, which has been looking for a really long time for a magic bullet. And he's saying that Alzheimer's disease is not caused by one thing, but it's caused by a combination of 35 or 40 things. Makes sense. You know, we all have different stories of the kinds of things that have affected us through our life. And some of them are things like low-grade inflammation. Some of them are things like low levels of vitamins or minerals or hormones or various other medical conditions like high blood pressure and diabetes and high cholesterol and other things that we're all very aware of for heart disease, but we really don't think of them as being important in Alzheimer's disease. It's other things like Lyme disease, which we're all pretty familiar with around here, and a whole lot of other things that can lead to damage to our brain. So the important thing is to analyze an individual very differently, and nobody's really looked at all of the things collectively and how you can fix them. So basically, the Bredesen approach is to do an extensive set of laboratory tests to look at all of those factors, and also to do a very innovative look at the brain. I think I'm just going to go ahead because we've got limited time. And so stop right there for a minute. But essentially, all of these factors cause a healthy brain, like the top half of the slide, to become a sick brain, like the bottom half of the slide. And it's very much like you nursing a sick plant back to health. You have to have enough sun, enough water, enough fertilizer. You have to have all the raw materials. And with the brain, there are a whole bunch of raw materials. And the research scientists like Bredesen and all the other people that were working over that 25 years when he took his time off from his clinical practice, there was research that said that healthy eating improved your brain. Exercise improved your brain. Brain games improved your brain. A lot of supplements improved your brain. Taking the proper care of all of these other health issues improved your brain. So he was able to put all of these things together, and if each one of these things made a little difference, couldn't doing all of them make a big difference? And again, this is just very quickly to give you an idea of how complicated our brain is, but that you can actually figure out this stuff. That when I look at any of you, my eyeball gives a signal to my thalamus that then sends it to my occipital lobe to start to analyze what I'm seeing. And then it sends a signal to my parietal lobe to analyze more completely what I'm seeing. And then once it's processed that, it sends it to my temporal lobe to analyze what I'm seeing. And then it asks another part next door in my temporal lobe whether I've ever seen that face before, whether that expression is something that I should be afraid of, whether I should run in the other direction, what I should do. And then if I want to keep that in my memory bank, it sends it to my frontal lobe to prepare it to take it from my thumb drive and put it in the hard drive when I go to bed that night. So all of these things are happening simultaneously and in a split second. Next slide, please. And most of you might have heard that, you know, whether you're left-brained or right-brained, or your left brain has to do with analytical stuff and your right brain has to do with artistic stuff. Next slide. And so that has to do with the fact that the left brain is words, math, numbers, but so the left brain figures out, tries to recall the math number. The right side of our brain tries to interpret that number and nuance it. So these things work together. So what we've done with these volunteers in our pilot group is we've started with asking them what's going on. And so this starts from people reporting to us what they have noticed with themselves or their spouses. And then if they don't know what's going on with them, again, like I said, we ask their spouse, and their spouse tells us. You know, and then we go on from there and we do a few simple tests to see how you process stuff now. This is a standardized test that's pretty easy to administer. And then again, we take some history with people, and this is a set of the chromosomes in a cell. And there is one little piece on one of these chromosomes that carries the gene that determines whether I inherit that factor from my parent or not. But if I study all of that and I ask you a lot of the usual questions about the conditions that you've had, and I do a whole bunch of blood tests, and then I also, most importantly, do an imaging test. You can do it. You go back one, please. When I normally would get an MRI of somebody's brain, I would just get a pretty useless sentence. The neuroradiologist would tell me mild atrophy is present. Wow. What does that do for me? And then when I get the patient in the exam room, they say, well, what's the test show? Well, it shows you don't have a brain tumor, but it shows you have mild atrophy. So how's that connect with what you came to the doctors for, with my memory? So Dr. Bredesen and his gang said, well, actually, there's a computer-based app that you can put on that MRI, and rather than get 4 words that mean nothing, I can get numbers for 80 parts of my brain, for every single individual that you order that test on. I had never heard of that. But I found out that, yep, they could do it at the radiology center in Brunswick, and I started ordering them. And the reason that no doctors order this test is they don't know what to do with the results. But what I did with the pilot group over this last year is I created a guide for what these 80 parts of the brain do. And I put it together with what the people were complaining about. So not only to tell you what part of the brain was involved, but what the function of that part of the brain was. And it was amazing with this group in our pilot group, that these things match. Somebody came in and I'd say, how are you? And one in particular said, I'd like to tell you, and this is the word she used, but I don't know how to articulate it. And then I said, well, very interestingly, this part of the brain that has to do with articulation is atrophied. This other part over here that also collaborates to focus on articulation is also atrophied. So it's not that you're not trying hard enough, it's that those pieces that do that work are damaged. And she started to cry. And I apologized for upsetting her. And she said, no, you made me very, very happy because I thought I was doing something wrong and I wasn't trying hard enough. And now you've given me some hope that there's a reason behind it. And she's working really, really hard on the program. Next slide. This is just another one to just show you, if you were looking up close, we'll go on, but this just shows that there are very, very great differences between one person's memory banks and another one's. Keep going. So the program is very simply a whole lot of stuff about nutrition, exercise, sleep, stress reduction, brain stimulation, detoxing from infections and poisons, and taking proper supplements to deal with a whole lot of things. But it's a very individualized program because in general, there are 35 or 40 factors that we're trying to assess. And most everybody who's having memory problems has 10 or 15 things wrong with their brain. So you're trying to create a solution of 10 or 15 options for people out of those 35 or 40 factors. All of them are very easy in one at a time, but collectively, it's a complicated program. But it's all built on the fact that the brain can grow new brain cells. We were not taught that in school ourselves. What you see is what you got, and it's only going to get worse. It's actually not true. Research has shown if you do the right number of things, anybody can grow new brain cells. So these people are not destined to just live that way. And this book about the first survivors of Alzheimer's is first-person accounts by his 7 first patients who improved and their story on how they got there, where they were before and where they are now. It's incredibly inspiring. It should be front page news, and hardly anybody knows about it. So with that, I think we can quit, and I'll just take any questions or comments, or if you want to turn on the lights, I think we're so thanks for letting me ramble on for a little longer than maybe you intended me to do, but I appreciate it. Yes, sir.
Could you talk a little bit about word finds and what that has to do with Alzheimer's?
Word finding and what that has to do.
Okay, so we have several language centers in our brain, and they're very specific places. On that colored slide of the brain, there is a small section, but I skipped over a lot of stuff. But I think the most important thing to mention is that no one section of these 80 parts of the brain works completely alone. Every single part of it, like the example I gave you of what I'm seeing, there are 7 or 8 or 9 parts of the brain that all contribute to me not being able to find the right word. So that word finding can be that I don't know how to say it. I've lost the access to the file drawer, like losing the key, or I don't have a courier to run to the file drawer and find it for me, or once I've got it and brought it to the table, the part that's supposed to analyze it isn't working. But what's really quite amazing, and the 7 people who told about themselves in this particular book point out, is that stuff doesn't seem to be permanently lost. It seems like people that used to know how to play the piano, if you correct the things that allow them to grow new brain cells, they can start to play the piano again. If people had lost their ability to read or understand what they were reading, they start to read again. One of these folks that is profiled here who had stopped reading because she couldn't remember the sentence that she just read is now reading scientific journals about brain function. So it's really remarkable that this is a sign of hope, and also that it's something that the people that are on this program now have been on it for 5, 7, 9, 10 years, and they're steadily getting better, even though they have, many of them that are profiled here had serious genetic tendencies. And that's what, they started, some of them started in their 40s having issues. Some of them started having issues in their 50s. And now they're all in their late 70s and they're doing really well. And they thought when they first heard of their diagnosis, they thought they would have been dead a decade or more ago. So it's really quite remarkable stuff to talk about. Yes.
You mentioned, thank you for this. You mentioned detoxing. Is over-medication a risk factor for Alzheimer's?
Repeat the question, please.
Yeah, the question is whether over-medication is a cause of Alzheimer's disease. Is that right? Probably the wrong medication. And interestingly, a lot of common medications hurt the brain. One of the scariest things to talk about this time of year, or probably this rainy summer that we've had, is that antihistamines that we all use to fight allergies, many of the antihistamines have something called an anticholinergic side effect. And anticholinergic is impairs the cholinergic receptors that are a part of how our brain sends signals. So there are amitriptyline that I give people to deal with sleep or sometimes with depression is not so good for the brain. So I think the easiest thing to try to explain this really complicated story is that there are 35 or 40 different factors, and some of them are real obvious, and some of them are pretty subtle. Some of them are really hard to find. But the nice thing is you don't have to be perfect on any of the factors that he's talking about to improve. Certain people who exercise a little bit and then can exercise a little bit more. Certain people that eat healthy a little bit and then eat healthier and eat healthier. Little by little, the brain fog improves. So it's kind of hard as a skeptic and as a physician to think that if I just ate healthier, I would be able to think more clearly. That's a pretty big leap of faith. And after reading and seeing it firsthand with some people and reading more about it, I'm a believer. But I really think if I were to start anywhere with anybody, there's nothing better than people who were scared to death improving and telling their own story. That really, really is powerful. Yes, sir.
Has the Alzheimer's Association finally kicked in with any money for the advanced research here?
No, this is still being relatively clobbered in the scientific world because it is a program of multiple factors. And they say, what about confounding variables? You know, what about your control group? What about people who only do one of these things rather than all 15 of these things? So they're used to a paradigm where you say, okay, magic pill, we'll give half of the people this magic pill, and we'll give half of the people a placebo, and then we'll see who does better. The reality is when you're dealing with lifestyle, and this is what we at the Health Center have struggled with as well. How are we really going to measure what we're doing? Because maybe I fell off the wagon and didn't eat well this whole last week. Maybe I didn't exercise for a couple of weeks. Maybe I stopped taking my supplements. Maybe I was tired of those damn brain games. And again, most of the situations they're really hard to factor in because this is real life, you know, and in real life, we're not perfect. You know, and what I've seen again among the examples of the people in the book are that when they fall off the wagon, within a few days or a week, they start getting fuzzier again in their thinking. And that kind of says, I got to get back on that wagon. I don't feel as good. So that's really the huge motivator for an awful lot of these people. And it's something that medicine hasn't really appreciated. When I've spent 30 years trying to get people to follow, you know, particular lifestyle changes with very little success, because most of the benchmarks for whether my diabetes better or my cholesterol is better is a number. It's not whether I feel better. And if you're dealing with something where it says, I feel better, that's a pretty good motivator to say, I think I'm going to keep doing this.
Ask online if people have questions. Ask on Zoom if people have questions.
Sure. I'm sorry.
I don't know. Any questions?
You'll have to plug in the speaker.
Any questions for Dr. Teel from the Zoom folks?
Not chat.
No, I think you're all muted, so you could unmute.
They can unmute themselves.
Okay.
That's one way to keep questions down.
Right. All right. Well, I want to thank you all for your perseverance. Yes.
Yes.
Well, I'd just like to thank Dr. Teel for, as a practicing physician, to engage in research and to have an open mind to find out the hopeful path forward. And I think this whole notion that we have a tremendous capability to rejuvenate our capacity is the most important message to share.
It's really been very stimulating for me. I don't think I've been this energized in healthcare in a really, really long time. You know, I think the idea after prescribing a lot of medicines and we're telling, I think the most powerful feedback from many of the participants in our program was that many of them, when they spoke to their regular neurologist about their spouse's memory issues, they just say, yeah, get used to it. Or they would just say, sorry, Just keep taking the pill, we'll see you next year. So the idea of being able to give people support and hope is a phenomenal difference. And it's a real feel-good high for me. So I've enjoyed every minute of it.
What is your percentage of Alzheimer's patients that you take care of now?
I'm doing nearly all of this. And I think, but your question, if I may, is to try to describe the terminology. I'm trying very hard to not distinguish between dementia, Alzheimer's disease, memory loss, mild cognitive impairment, senior moments, whatever you want to call them. I don't think the definition is all that important. I'm finding the most important definition is how's it affecting your daily life? And tell me about that. And let's see if we can figure out how to make that better. So an awful lot of this is trying to take everybody who says, I got a memory issue, and trying to run it through a Bredesen type program to try to see how we can make it better.
What's the usefulness of some of the drugs that they're pushing? You see them all the time. There's one, there's new ones all the time. President, these drugs, are they any useful?
I haven't seen a study that says that the value of the drug is inversely proportional to how much TV advertising is done for it. But, but I think it, there are a lot of people that are taking Prevagen, and I think there is a small part of the ingredients that are in that are probably not bad for your brain. But as far as a be-all, end-all for the price they charge, I think there are more comprehensive and better ways to get at it. But I just started a second new group yesterday in Damariscotta, where my regular practice is, and I have about 15 people in that group. But the reality is I tried to recruit 5 or 10 others for that, and most of them said, no thanks, I really don't want to change, and so the hard thing is the change is hard, and it really is important, but none of these things are a surprise, I'm sure, to anybody in this room. Most of them have to do with the fact, food is the hardest thing to deal with, and it's the biggest ingredient to improve people's brains. But none of the advice is extraordinarily unusual. Have less processed food, eat more veggies, less sugar, not a surprise. So these are the kinds of things that, and it's all, like I said, it's not an all or nothing kind of thing. It's really about just getting the proportions better. I kind of give the example that I give to some of the people in my class, and you try to make it real simple. Well, what can I eat? Well, bacon and eggs are good. Just don't have sugar and don't have toast with it. Lunch is fine. Yeah, it's got to be a salad, but it doesn't mean you can't put shrimp or bacon or chicken or cheese and seeds and nuts and everything else on the salad and make it really sweet for lunch. For dinner, it's either a stir fry or, but rather than a pile of rice with a couple veggies on top, it's a pile of veggies with a couple of kernels of rice under it, or if it's spaghetti and sauce, as opposed to a whole mound of spaghetti with a little bit of sauce on top, it's a whole pile of vegetables on top of a little bit of spaghetti. So it's a kind of a proportion thing, you know, and really it's just trying to, it's surprisingly, as somebody who loves his or loved his junk food, you know, I will acknowledge that there are some things that are harder than others. But I've really been surprised over this last year and a half, that you kind of get into the habit of it. And there are plenty of tasty ways to make it work.
All right, I'm gonna thank you. And I just want to close by saying that all of this work is being essentially time donated by Dr. Teel and funded, you know, out of our pockets. We don't have any grant money. We don't have any donations that's really supporting this work other than what the patients themselves are contributing. So please think about us when you're getting out your checkbook. Thanks.
Great, well, thank you for that very interesting presentation. That's kind of the only last thing I'll say before we leave is people power. I meant to say this during the meeting part, but you know, the brain tech didn't connect quite. But anyway, we really were having trouble with people power since we started meeting again, and you know, people just aren't used to it. Mike has the sign-up sheets back there. We need waiters, we need stewards, we need innkeepers, we need sergeant at arms, scribes. So please. And it's a great way for new members to meet people, because if you're serving food, people will want to talk to you and have a big smile on their face. All right, so please sign up. Please look at your attendance and pitch it. So it's very important. Anybody have anything else? All right.